Hi, my name is Heather Ramos, and I'll be performing the oral medication administration skills video. I'm in my school uniform with my school badge, and I have no artificial nails or nail polish. The MAR that I'm going to be using today is MAR number 1. These medications are to be given daily at 9 a.m. per the physician's orders. I'm going to do a quick room scan so that way you can see my environment first. Okay, so I have my mannequin here, okay, and I have my medications, and in front of me is my desk. Okay, plug my laptop back in. Okay, so I'm going to verify the physician's orders in the electronic medical record. Okay, I'm going to verify using the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. So I will check the medications against the physician orders. I'll do this 3 times before giving the medication to a patient. I have calculated the correct dose to give to the patient. We do have a liquid form of this on MAR 1. It's acetaminophen, and the physician has ordered 500 milligrams per ml, and I have calculated the correct dose for this medication. I'm going to go and enter patient's room. Enter patient's room and close door for privacy and perform hand hygiene. Hi, my name's Heather, and I'm going to be your nurse today. Can you please tell me your first and last name and date of birth? And then verify using 2 patient identifiers against patient's wristband. Thanks, Mr. Smith. Okay, so your doctor today has ordered 4 medications to be given. 3 are in tablet form and 1 is in liquid form. Okay. Before we begin, do you have any medication allergies? Do you have any food allergies or seasonal allergies? You don't. Okay, so I'm going to go ahead and check the medications again. So I have my medication labels. I'm checking for that against the patient's wristband and again in the electronic medical record. At this point, I'll also be confirming that the patient doesn't have any allergies as well as previously stated. I'll be performing my pre-assessment checks for these medications. The first medication is diphenhydramine. So my assessment would be checking the patient's level of alertness, is patient at fall risk, and also monitoring the heart rate and respiratory rate. The second medication is furosemide. So I'll be monitoring patient's blood pressure. Is the systolic blood pressure below 90 millimeters per mercury? If it is, then I would like to notify the provider. Provider may want to hold medication. I would also be reviewing patient's lab work, such as potassium levels, electrolyte levels, and also renal function. Also checking patient's weight for any fluid imbalance or fluctuation, and also urinary output. Okay. The third medication is ferrous sulfate, and I would want to get my pre-assessment check would be getting a baseline for his hemoglobin and hematocrit level and assess for any GI symptoms. The last medication is in liquid form. It's acetaminophen. Prescriber has ordered 500 milligrams per 15 ml. I would like to assess patient's ability to swallow, if he's going to be able to tolerate that medication. Because this medication is given for pain and or for fever, I would assess patient's pain level on a 0 to 10 scale. Whereas patient at now, so I can assess trends for later. Likewise with temperature. I can monitor patient's temperature now, before medication, and then post-medication. I would also check for patient's liver functions on his lab work. If patient already has history of alcohol abuse or liver damage, provider may want to hold the medication. Now that I've done my pre-assessment checks, I'm going to go ahead and review these medications with this patient. Okay, Mr. Smith, so doctor has ordered 4 medications for you. He wants you to take them daily at 9 in the morning. 3 are tab form in tablets, and 1 is in liquid form. Okay, so the first medication is called diphenhydramine. It's 25 milligrams. It's commonly known as Benadryl. It is used to treat allergies like sneezing, itchy, watery eyes, and it also can be used as a sleep aid. Its action is how it works is it's an antihistamine. So it blocks histamine 1 receptors and reduces an allergic reaction. Okay. So common side effects would be drowsiness, dizziness, and dry mouth. Adverse side effects are something that I would like for you to be aware of. They are less common, but if they occur, please let me know. You can hit your call light. That would be if you experience any confusion or urinary retention. The second medication is furosemide. It's 20 milligram tablets, and it's commonly known as Lasix. It's used to treat edema or swelling, okay, from chronic heart failure, kidney damage, or liver damage. The way that it works is it's a loop diuretic. So it stops the sodium chloride reabsorption in the loop of Henle, increasing your urinary output. So common side effects would be increased urination, electrolyte imbalance, okay, and dizziness. Now, if you experience any adverse reactions, that would be hypokalemia, okay, so heart arrhythmias, ototoxicity or hearing loss, okay, or dehydration. The third medication is ferrous sulfate, 65 milligrams. It's iron, and it's used to treat anemia. And it's common, the way that it works is it's an iron supplement. So it restores iron so that is needed for red blood cell production. Okay, common side effects would be constipation, it would be dark colored stools or nausea. And adverse side effects to this medication would be any unexplained fever, it would be vomiting blood, or a severe allergic reaction. The last medication is in liquid form. It's acetaminophen, 500 milligrams, and you'll be receiving 15 mLs. Its common name is Tylenol, okay? And it's used to treat moderate pain and fever. The way that it works is it stops the production or synthesis of prostaglandins, so it inhibits the pain impulses, and reduces your fever. Some common side effects could be headache, could be nausea, or rash. Right now, if you experience any adverse reactions, this would be hepatotoxicity or liver damage, or a severe allergic reaction. Before I give this medication to you, do you have any questions for me? Okay, so I'm going to check the medication one more time at bedside, verifying that I have everything. This is my third and final check. I'm going to perform hand hygiene and then put on some clean gloves. For tablets, you want to get patient into either a sitting or side-lying position. Mr. Smith is already in a sitting position, so I'm just going to confirm if he's in a comfortable. Are you in a comfortable position? All right. Would you like a sip of water before you take any of the medicine? Patient accepts sips of water, and this is a great time for me to assess patient's swallowing ability. Okay. So these are the 3 tablets that we discussed previously. This is your diphenhydramine, you have your furosemide, and your ferrous sulfate. So patient takes the medication, okay, with his water, and hands me back the empty medicine cup, and I'll discard. And I'll place his water cup down. So we also have our multi-use acetaminophen bottle. The prescriber has ordered 500 milligrams for 15 mLs. I have already calculated the dose for this medication. I'm going to thoroughly mix the medication by inverting just a few times. Okay, I have my medicine cup here. I'm going to lay flat. Now I'm going to unscrew the cap with the lid side up and put that on the table. I'm going to place my palm over the label of the medication. So if there's any spill, it would go on my glove and not on the label. I'm going to get low so that way I can see the 15 ml line. I'm going to wipe the mouth of the bottle and then recap. I'm going to show you the 15 mLs. See, there's 15. Okay. Okay. So give the patient the medication, and he hands me back the empty medicine cup, and I'll go ahead and I'll discard that. I'm going to remove my gloves, discard, and perform hand hygiene. Mr. Smith, are you in a comfortable position, or would you like for me to reposition you? Patient's in a comfortable position. Is there anything else that I can get for you before I leave? No? Okay. I'm going to reiterate to patient that if there's any adverse side effects, to hit his call light. Okay. I'm going to document that I administered the medication to the patient. I'm going to perform hand hygiene, exit patient's room, and then close doors for patient privacy.